Greetings, everyone. Alberto Vasallo from El Mundo Boston from our La Hora del Café studios here in East Boston. And as we often do here in El Mundo Boston, today we'll be having a candid one-on-one interview, a conversation really about several topics of interest with a community leader. Today it's one who not only leads an important organization that has a tremendous impact in the region, but his organization has also been the focus of several conversations around different health issues. And today we're going to talk about several of those. We're going to address directly some of the ones that affect the East Boston community, as well as the Latino community. So I'd like to now welcome Greg Wilmot, CEO and President of East Boston Neighborhood Health Center. Buenos dias, Greg. How are you? ¿Cómo estás?
Good morning. Good morning. I'm doing very well. And thank you so much for having me today.
Excellent. So as we often do with these one-on-one candid conversations, I always like to start off with a little overview of your organization, kind of the scope and size. I know East Boston Neighborhood Health Center for many years, but let's go over that. How many years has this organization been in the community? What's your main focus? Give me a little overview of East Boston Neighborhood Health Center.
Wonderful. So the East Boston Neighborhood Health Center is our state's largest community-based, community-focused health system. And we have been here for 50 years serving this community. We serve over 100,000 patients annually. 70,000 of our patients, 70% of our patients identify as Latino, Latina, or Latinx. We employ a fairly diverse staff. The majority of our staff, 50%, come from the communities we serve. And about 50% of our staff identify as Latino, Latina, or Latinx. Our leadership team is highly diverse as well. I would say many of our leadership team, including myself, identify as immigrants or first-generation immigrants. And our board of directors is a community-led board of directors. All of our board of directors come from the community. The majority of our board are patients of the health center. But we are committed to compassionate, high-quality healthcare services that are person-centered, culturally informed, and language appropriate.
And just to kind of add a little bit of the scope before I go into some of the other questions is, during the pandemic, your organization was instrumental in responding to COVID-19, especially in the Latino community. I know your staff stepped up. Tell me a little bit about those efforts. If folks don't know, some of the concrete steps, programs, and really things that your organization did during COVID-19, especially for the East Boston, Chelsea community, which was at the epicenter, by the way.
Absolutely. So what a challenging time for our communities. I think the health center and certainly many members of our community stepped up and leaned in, but specifically the East Boston Neighborhood Health Center, recognizing that when these challenges hit our communities, we tend to bear the brunt of many of those challenges as Black and brown people in our communities. And so we really leaned in fairly early to make sure, number one, that our communities had the right information, accurate information as to what was happening, and we continue to do that in partnership with organizations like El Mundo and others to get the word out as to what was happening from a science and from a clinical standpoint, what was happening. We also opened up multiple testing sites across our communities. We actually partnered up with the city of Boston to not just provide testing access for East Boston and neighboring communities, but actually the entirety of the Boston area. We were providing testing access. We also were treating many of our neighbors for COVID. So we had some special clinics designed specifically to handle people with COVID symptoms. And then when we had the opportunity to actually prescribe and treat people with oral medications, we were actually one of the largest prescribers of COVID treatment. And then lastly, I would say we were a major player in the vaccination space. We opened multiple vaccination centers across East Boston, Revere, Chelsea, and in Boston South End, where during the pandemic we acquired the South End or merged with the South End Community Health Center. And so we've really focused on access. But I would say, in truth, Alberto, one of the things that was really important for our organization is while we were providing those COVID services, we were providing primary care and preventative care services as well. We never closed our doors. We were actually open 24/7, 365 days a year, every second we were open and available to our communities, and that was really important for us as well.
All right. I really need to ask you about last week in the news. We covered here in El Mundo, en La Hora del Café, Centro Presente and City Councilor at Large Julia Mejia, were part of a press conference held at the health center around concerns from both specific parents and about the organizations as a whole. Before we get into back the COVID, because I know we also want to talk about the end of the pandemic and what that means for the community, which is what you're one of the reasons you're here is. I really want to get into this. What is from your point of view, why is Centro Presente protesting? What are they asking for?
So thank you for the question. And important for me to acknowledge is that the voices of our communities matter. Our communities have largely, historically, in this country, in this state, even in this time, continue to be marginalized in certain cases, and it's really important that we continue to lift up the voices of our community. And what I would say, this is a conversation that has played out, I think, for over a year. I think the last time I visited with you, I'd just become the CEO, and some of these challenges were brought forward. And so, largely the focus has been on reforms that Centro and Centro Presente believe are important to improve care for communities of color, in particular Central Americans and immigrants. And they also, I believe, and I'm speaking from myself and the organization, I believe it was important for them to lift up the voices of members of our community. The dozen women that have come forward, I think, boldly have come forward to share their stories over their experiences at different points in the past, I think are really important to bring forward. And so I think Centro is largely focused on those two things. And they've asked for the Attorney General's office, this was last year, to review aspects of these cases and determine if there was any concerns from those cases. And I will say that the Attorney General's office, we partnered with them to make sure that they had access to all the information that they needed to be able to understand the work that we do here. And that happened over the course of 2022, and their review concluded with no findings of any concerns of systemic quality issues or systemic discrimination. But I share that just to say that the voices of our communities matter, and while those reviews did happen and did not have any findings around discriminatory practices or quality concerns, that does not negate the experiences of these courageous women. And what I would say is we appreciate greatly the feedback. And what I would also want to just extend is that the descriptions of those experiences, simply stated, are unacceptable. And we are committed to working with those families to make sure that they are supported, that they have access to any resources that are appropriate for them, but also that we apologize for failing them, or at least not meeting their expectations relative to the experiences that we want them to have with our organization.
I see Centro Presente is claiming kind of systematic to the way East Boston Neighborhood Health Center operates. I think that's the bigger question here. Are these exceptions? Are these part of what goes on? And is your organization discriminating against undocumented women because they can't speak Spanish or they don't have their paperwork?
Yeah, to answer your question just on discriminatory practices, I will say this unequivocally. No, we are not discriminating against our neighbors. And I say neighbors intentionally in that the majority of our patients, 70,000 patients that we serve, identify as Latino, Latina, or Latinx. 25,000 are uninsured. That's the largest uninsured population served by any community health center in our state. We are committed to providing high-quality, compassionate care to all, regardless of background, regardless of ability to pay, economic status, immigration status. That is core to our mission. It has been for the last 50 years, and it's true today more so than ever before. And I would say we've, certainly have gone through, last year specifically, a number of reviews. I mentioned the Attorney General's office. We also had a review by HRSA, the Health Resources Services Administration that governs community health centers. We had our review by them. We had a review by the Centers for Medicaid and Medicare Services, CMS. We had a review by the Department of Public Health. And all of that was done transparently with the goal of inviting those agencies that govern the work of our organization and healthcare organizations across our city to review the data that we were, the work that we do and the practices that we have to serve our community. And in all of those instances, there was no evidence of any discriminatory practices or any systemic quality issues. But I share that still with an understanding and appreciation that the experiences of our patients matter and their voices need to be heard. And sometimes in that quality data, even though we're delivering, in many instances, on par with large academic medical centers, world-renowned academic medical centers, while we're on par with them from a quality standpoint, in some cases exceeding them, and particularly in service to the Latino community, that does not negate the experiences that I described as being unacceptable. And so while we continue to lead the way on health equity, we also need to lead the way on creating safe spaces for our patients to express their feedback, and so that they can be heard, their stories told, and that we can support them through their healthcare journey.
Very good. I think you've addressed that very directly. Now that the pandemic is kind of over, right? The health emergency has officially ended. What does that mean for East Boston and other communities that you serve? Like, what impact directly does that have in our community?
Yeah, so the pandemic is, I think, officially over. At least the public health emergency declaration is officially over as of last week. And it's an important moment for us as we turn the page on the pandemic and really look to the future and look to the state of our communities. We're still processing and reviewing the Health of Boston report that came out earlier this week, but it continues to highlight that we have disparities amongst Black and Brown communities that need to be addressed. And those challenges exist both in the exam room, but also outside the exam room. So the East Boston Neighborhood Health Center, as we think about the future, we've been laser focused on clinical quality and addressing challenges that occur in the exam room, but we're also looking upstream and we're recognizing that what happens in the community outside the exam room also impact quality of life and health and wellness for our communities. And so our strategies focus on both of those areas. And we recently launched our strategic plan, and it really does center around clinical quality, patient experience, access, and we're very much continuing to look at social drivers of health or health-related social needs as well.
And speaking of social needs, something that let's kind of conclude this conversation with you. The Sumner Tunnel will be closed from July 5th to August 31st, almost 2 complete months. What kind of medical impact will this have in the East Boston, specifically East Boston community?
Yeah, so the tunnel closure coupled with the challenges we saw emerge out of the pandemic have really impacted access. So we're focused on making sure that we have access to care. We've done that by completely overhauling our emergency department. We've actually just completed a multi-million-dollar investment in our emergency department that has completely rebuilt our emergency department from floor to ceiling. We've added new capabilities from a technology standpoint that introduce new imaging capabilities. We've done that to make sure that our communities have access to emergency care. We've also been working through a significant initiative, unlike any we've seen in the city in a long while, to expand behavioral health urgent care access. Behavioral health has been a major challenge for our communities and will continue to be, even when we look at the 2 months of the tunnel closure. And so we're launching a behavioral health urgent care service in August of this year to help address and mitigate some of the access issues that our communities are facing. So a lot happening there, and we're continuing to just stay on top of it as the largest employer in this area as well. It's really important that our staff and our staff are able to access this area. And so we're continuing to look at this and figure out how do we mitigate the challenges of traffic that we're going to see.
Well, Greg, I want to thank you for stopping by this morning here on in the La Hora del Café studios here in El Mundo in East Boston. We're neighbors. I think it was important for us to kind of address some of these very important issues about the pandemic, about the Sumner Tunnel closing, obviously give an idea of what your service is done, and also what's been going on in the news with the Centro Presente protests and so forth. So I think you've answered all my questions for this morning. I think you're free to go, sir.
Well,
you are dismissed.
Before I'm dismissed, I do want to just say thank you to El Mundo. When I talked about getting information out to our communities, you've been a vital part of that, certainly over the last several years with the pandemic, but true also for the last 50 years. So just a thank you to you and your team for what you do, and just want to continue to lift up our healthcare workers. And so a thank you to my colleagues at the East Boston Neighborhood Health Center and our many partners across our communities that we serve.
Very good. And don't forget, La Hora del Café airs every day, Monday through Friday. We do take weekends off. At 7 in the morning to 8 a.m., 1 straight hour, a daily dose of positive, energized news with a great team. So tune in if you can at 7 in the morning on Twitter, YouTube, or Facebook. Thank you, Greg.
Thank you.